How can I prevent from getting hard breasts?
Here is a silicone breast implant. You know, this is not human. It doesn't get harder or softer. It stays just exactly the way it is. But the body's response to it determines whether it's hard or soft. So if there's a lot of scar tissue around this, then it gets hard because it's like taking a balloon and squeezing it. It feels harder. It's all about the immune system. Our immune system is really, in many ways, kind of primitive, very similar to an oyster. An oyster gets a piece of sand in its shell, and that piece of sand irritates its delicate body so that its immune system puts out scar tissue which surrounds the sand, and it's very hard. Well, very similar to what happens to breast implants or anything else foreign in the body. So the body's only response is just like the oyster, it walls it off. When we put in breast implants, up until recently, the only thing we could do is take this piece of silicone, make an incision, in our case, around the areola, and then you'd push it in like this. We'd be pushing like this and dragging in all the bacteria on your skin in there. So the way to prevent that is to not let skin bacteria get inside of you. There was a guy by the name of Keller, Dr. Keller, and he figured out somehow or other that if you put an implant and you put it in a very strong, I don't know exactly the term, I call it cake decorating funnel, but maybe it was...
I call it a funnel.
Okay, cake decorating funnel. So you put it in this, and you put it, in our case, at the areola, and you squeeze on it, and you have an opening sufficient to allow it to come out, and it can go inside without ever touching the skin. And that was a brilliant, brilliant thing. And I was fortunate enough to be one of the authors of a paper that showed, at least gave the first indications, that the Keller funnel decreases the chance of capsular contracture of hard breasts. So what you would want from your plastic surgeon is that I use a Keller funnel for both implants that we're putting in, and we do. The second thing, and I kind of think it's the most common reason for hard breasts, but there's some argument, could be the second most common, is blood around an implant. So what you have to do is you have to stop all the bleeding arteries and all the bleeding veins before you close the pocket with the implant in. Well, a good plastic surgeon can just about do that every time. Problem is nobody can stop capillaries. They just ooze like crazy. So you must put a drain in. So we drain all our breast implants and usually take out the drain the next day. However, if the drainage is too much, we might leave it in 2 or 3 days. But probably 95, 98%, we take it out the next day. So you want me to use a drain and you want me to use a Keller funnel, which we do.